And many of you have emailed us asking about the vaccine rollout, confused on who's getting it and when. News 8's Heather Walker is working on clarifying the plan for us tonight.
Another round of hospital employees received the vaccine today, some of which have not been in a hospital setting since the beginning of the shutdown, which had many of you wondering why they're getting the vaccine while others who are vulnerable are not.
I hear their concern. I want my parents to get vaccinated, but we also really need to go by what has been decided for us.
The Kent County Health Department Medical Director, Narari Bora, points to the Michigan Department of Health and Human Services, who created the vaccine rollout for our state. Right now, we're in Phase 1A. According to the state website, that phase includes paid and unpaid persons serving in healthcare settings who have direct or indirect exposure to patients or infectious material and are unable to work from home. But some who are receiving their shot today or before today are working from outside the healthcare setting, in office or administrative roles. When we asked the state why they're getting a priority over people who are older and more vulnerable to the virus, a spokesperson responded that in Phase 1, the hospital can vaccinate people who they need to keep their operations going in the hospital. Spectrum Health will have 15,000 vaccines distributed by the end of the week. Mercy Health now at around 5,000. Phase 1 includes hospital workers and staff at long-term care facilities, which began last week, along with their residents. Dentists, ambulance, and home health care workers are in the next phase. Bora estimates that by the end of January, beginning of February, the public who are 75 or older will start receiving the vaccine, along with frontline essential workers.
How will the vaccines be distributed for those individuals?
You know, I think we still have a lot of questions because
She says the rollout depends on what vaccine is available because the Pfizer vaccine requires special cold storage. Every week, the state makes requests for the vaccine. But as of now, it's a waiting game for how many doses we receive.
I want to be able to plan. We all want to be able to plan further into the future, and we just have limited information to do that. I know people are tired of being patient. I completely understand, but we're still asking for patience in this.
There are 2 more phases for those 65 to 75 and people with underlying health conditions, and then mass vaccinations. The goal for the state is to have roughly 70% of the adult population vaccinated by the end of the year. Reporting from home, Heather Walker, News 8.